Like any other profession, the health system in Malawi has its frontline workers, specifically nurses and midwives. The health sector is more of a calling than a mere occupation. It hinges on life and death, hence becomes a highly delicate and sensitive workplace. Working as a nurse or midwife in Malawi has its share of challenges.
We are only two nurses, which means when one is on duty, the other one is on off duty. And the one on duty, which means we will work for 24 hours day and night.
Our lives are in danger. Yeah, but we can't do otherwise. We promise to work and we promise to save our fellow human beings.
Realizing the need to support this noble calling, the National Organization of Nurses and Midwives of Malawi, Nonm, was registered as a union of nurses and midwives in the country. The body, which was established in 1979, never performed optimally due to policy limitations until its revival in 2005. Nonm is an affiliate of International Council of Nurses and works in solidarity with local and international trade unions and civil society organizations. As a union, the institution is the only voice that nurses and midwives have in the country. Regina Mankamba is the executive director of Nonm. She unpacks merits of belonging to Nonm, citing the facilitation of lobbying and collective bargaining on issues affecting the nursing profession as one of the several.
We lobby for issues related to locums, we lobby for issues related to professional uniforms, we lobby for protective wear, especially in these times of COVID. We've done that and we've achieved it, and it has benefited our members. If it wasn't for Nonm, there could have been challenges. There are so many policy issues that need to be addressed, and there's no other organization that can do this. There are also professional issues that need to be lobbied for, need to be advocated by an entity. We need to do this together. United we stand, divided we fall.
Under a project called Norwegian Nurses Organization, NNO, which was rolled out in 2019 and will run until 2023, Nonm has been building capacities of nurses and midwives in the country with funds from NORAD. One of the objectives of the project is to ensure that Nonm becomes an effective watchdog and an advocate that can stand up for its nurses.
The Norwegian Nurses Organization has been supporting us for quite some time now, 15 years, and they've been our biggest development partners who've been working with us. And we are very thankful because Nonm is what it is now because of them. Our project, it's called the Closing the Gap, Competent, Sufficient, Motivated and Empowered Nurses. This project is mainly, in general, empowering the nurses. So we are doing capacity building activities, trainings on leadership, labor roles, trade unionism. As you know, this is a union. And also we've been doing advocacy activities, and these advocacy activities have been there to support the nurses through their personal issues and also professional issues which require someone to advocate for.
Despite the operations of the project being interrupted by the scourge of COVID-19, it has registered significant strides towards achieving the intended targets.
Since the project started, the activities have been going quite well, and in the year 2019, the project was able to meet its targets. However, in 2020, we thinly managed, because of the reason we all know, the COVID-19 pandemic, we were unable to carry out some of the activities, especially at the beginning of the second quarter. But right at the end, when we saw that the figures were going down, we were able to move, but with restrictions. So we're not able to do some of the activities that we were supposed to conduct. But nonetheless, we've been able to do a number of things, and we can happily say that we met most of the targets that we were supposed to meet.
A SNAP survey conducted among the nursing fraternity in some health facilities across the country shows positive impacts that Nonm has contributed towards the improvement of the health system in Malawi, one of which is the review of risk allowances for nurses and midwives, as well as all health delivery personnel amid the proliferation of COVID-19 pandemic.
We realize that sometimes when we do these lobbying and advocacy issues, it's not necessarily only for members. Other nurses also benefit. That's why we are calling everybody to be part of this, because the benefits that are gotten from these lobbying and advocacy issues, they do not only benefit the members, they at the end benefit everybody. For example, the risk allowances that people are now enjoying after COVID-19, it was from the support of this organization.
We are exposed to a lot of diseases, and previously it was 1.5, it's not 1.8, as a risk allowance, which was very unfair to me, because there is TB there. There are a lot of things there, conditions that we as healthcare providers were exposed to. The new risk allowance, to me, it was something that encouraged me.
By belonging to Nonm, a member is privileged to attend trainings in various strategic skills like leadership. Miriam Hanja is a senior nursing officer at Zingwangwa Health Center in Blantyre. She is Nonm secretary for Blantyre chapter. Miriam says she has attended a number of workshops that have sharpened her leadership skills, thereby equipping her for more effective frontline service delivery and team management.
Nonm has organized leadership skills and also labor issues that nurses need to know when they are exercising their duties in the health facilities, especially us as nurse leaders. Nonm has organized training so that we should know the labor laws that guide us in directing our fellow nurses and midwives in the facilities. If there are any disciplinary issues, how we will go about them, how we handle them, so that all other issues should be tackled according to the laws of Malawi, and also how we as leaders, the skills that we can use to manage our fellow nurses and midwives in our facilities.
The training which was offered to one of our leaders, Caroline Mandauka. We received an invitation from Nonm that she has to go and attend this training. It was not just done as it is as other trainings have been conducted, but this one was for a considerable period of length, for about, I think, 9 months or so. She graduated. So that was a great achievement. It benefited us as an institution, but also that section of the nurses.
In the northern region, capacity building initiatives are yielding positive results. Nonm membership, especially in CHAM facilities, has hit record 100%.
The success behind this membership has been on the orientation which we had in 2019. We had a visit. We went to Norway just to learn from the Norwegian Nurses Organization how they manage that. And we had to borrow some of the things. And as a member-based organization, that is our core business. That is our source of income. But this source of income, it has to go back to them. The members should be able to enjoy. So you find that between 2019 up to date, as we are closing the 2 years, we have done a lot of trainings. We have done a lot of orientation, targeting at both managers in facilities, but also members as well as non-members.
Further, Nonm members enjoy the benefits of upgrading their profession. Our
website is linked to a site where members would also be able to get continuous professional development. So when you're a member, you're assured of being able to get professional development instead of you moving distances to access trainings. With that, you'll be able to register with the Nurses Council, which is a requirement for Nurses Council. So being a member, you get your membership number, and that allows you to access this continuous professional development online.
After 2 years of working, I went to upgrade myself because by then I was a nurse midwife technician. So I was one of the beneficiaries who attended that. So to me, I would say Nonm has helped my profession a lot because from NMT, I'm now a registered nurse midwife.
There are people that haven't been promoted for a long time. Those are the issues that we lobby for with Ministry of Health. To say people have upgraded themselves. That's the message that our leaders tell us. Go to school, get good grades, upgrade yourself, and we are doing that. And as a Nonm, we are also saying, telling the employer to say, okay, we've done what we're supposed to do, and I think you need to do your part to provide the promotions that are due to these people.
Nonm members also enjoy social support services during bereavement, sicknesses, wedding ceremonies, and several other instances that may demand similar need for support.
When you're a Nonm member, you are assured of being supported in all social passages that you may pass through, be it funerals, weddings, engagements, birth of children, and whatever. When the branch, for example, is very much organized, members do access financial support in their financial need.
I've seen Nonm transforming people because we had that part of the project that we embarked, that as nurses we also have to be entrepreneurs.
We have a funeral cover which we run with the Midwife. So when you're a member of Nonm, in times of need, economic need, when somebody passes away, then our members do receive funeral cover from Midwife insurance with support from Nonm. So that is also one of the economic benefits that our members do receive.
The Constitution for Nonm provides that there shall be a legal counsel on the board to provide advisory and litigation functions to the board, committees, and the secretariat. Remarkably, this has improved the quality of disciplinary hearings conducted by the regulator, as explained by Mauya Msuku, legal counsel for Nonm.
As far as disciplinary issues are concerned, we have done so many specific cases, dismissal here, dismissal there.
My colleague reported me to the management that there's a Jehovah's Witness employee here. So to them, they were saying that a Jehovah's Witness is not a Christian. So they dismissed me. So I went to Nonm, and Nonm helped me that no, we have good freedom of worship here in Malawi. So they gave me a lawyer, and my case went into court, and I won the case.
The legal counsel of Nonm says they challenged in court the entire disciplinary process which was being executed by their regulator. As a result, the health profession in Malawi now adheres to redefined guidelines sanctioned by the court whenever disciplinary hearings are conducted.
A nurse was called at around 2 p.m. to say he's supposed to appear for disciplinary hearing at 9 the following day, and the nurse was in Blantyre, the hearing was in Lilongwe. She came here not knowing the charge. When she came here again, the complainant testified separately. She was outside. When she came in, she was just told, "No, we have heard so, can you explain something?" How do I explain? I don't even know what this person has said. She was suspended for 2 years. We took it up to court. We took that as a test case to say, no, we won't happen, because we had protested before, but we couldn't agree. So we took it to court, and the court basically agreed with us on every aspect. So the court gave us more or less like guidelines on how fair disciplinary hearings should be conducted. And since then, we can say that we're very happy with our regulator now, the way they conduct their disciplinary hearing. But it wasn't easy. It was after a lot of fights, struggles, and we had to go to court, and the court basically had to uphold every argument that we had.
Msuku bemoans the tendency by some health administrators who victimize nurses and midwives for joining unionism.
Most often, the employer has a stronger bargaining power than the employees. And therefore, especially with our professional, with our background, the training we received, we have been given names like, oh, you are angels and whatever. So most often, pushing or setting for even what is right for hours may not be easy. Sometimes individual members would not push for their rights for fear of repercussions, like for example dismissals or whatever. The union comes and fills the gap. We have represented so many of such individual members. That's when sometimes the union comes in, sometimes actually to fight for individual members as well as collective. Just recently, I will give an example, just recently we had the COVID-19 issue, right, where you have nurses, midwives, healthcare workers generally being exposed to all sorts of unsafe environment, right? We as a union, we said, we put our feet down, at the minimum, provide our members with PPEs, right? And we made a resolution where there's no PPE, our members are not working. Because it's unsafe working environment. Not that they are striking, but the law provides for safe working environment for everybody. We need to emphasize here that nursing is a profession, yes, but nurses and midwives are also employees. And the rights that accrue to every employee equally accrues to nurses and midwives.
In this life, there are times the unimaginable will happen. Such an experience happened to Clifford Semu. He is a nurse midwife technician who joined the Ministry of Health in 2003. He is married and is a father of 4. While on duty one day in November 2019, Clifford managed a pregnant woman with a complication. The woman later died upon being referred to a tertiary health facility. Following this sad development, the community in anger lost patience and retaliated by ransacking his house and property worth millions of kwachas. He explains how Nonm came to his rescue.
Nonm members, secretary came when we were offloading some remaining of my properties. They saw, they took pictures, and I think I've been going to the wrong way, seeking for legal aid. They assisted me a lot, and they gave me some cash. We have at least resettled, because as I'm speaking, with that little amount, I ventured into certain business. I managed to finish my house at Imponera. Here we have some food. I managed to purchase another car to be here as I'm speaking. It's because of Nonm. And I reached a certain point whereby I wanted to commit suicide, because I was looking at my kids. By then, my 2 kids are at secondary school. So I was looking at, one is in Form 4, one is in Form 1. I have another these kids, and I also have my brother's kids. But so I had no hope. Where to go? Where can I find money? What can I feed them? What is my survival? But they have been there. They have been calling me, don't worry, we are going to do this. Don't worry, we are going to do this. They have filed an application for compulsion to Attorney General. And in counseling, he has been there advising me what to do. Because I do contribute about 1,500 in a month. But what they have offered me is more than that. And I cannot manage to pay them back. And I've been telling my fellow nurses that if you are working in the facility without being a member of a Nonm, you are nothing. Because you never know what will come.
In order to instill a sense of professionalism and hard work among nurses and midwives, Nonm recognizes exceptional member commitments towards adherence to work ethics and personal dedication.
We award best nurses, and the best nurses that are awarded, for you to be able to be part of that, you need to be a member.
Emma Makina is one of the recipients of Best Nurse Awards by Nonm.
The patients are my bosses here. So every day when I'm coming here to work, there's many goals. Like I want to impress someone, I want to make someone happy, I want to see someone being healed, I want to give a smile on the same family. As of now, I'm working in emergency, so I'm dealing with adults. So I want to see someone maybe with diabetes, she or he was in hyperglycemia, is going home happy and being healed. I know I've been recognized by my colleagues and also by even other patients under my care.
While commending the outstanding contributions Nonm has made towards improvement of the health sector in Malawi, the nurses and midwives have this to say.
Nonm is still fighting for nurses to attain the positions that the government never had in the structures of the government. So for most of the nurses would only attain a certain grade and they will not go further because the government structure did not include it in the structure before. So we want to encourage Nonm to continue fighting for the structures that will enable us nurses to go further in positions right here in our district councils.
It's not on to have those nurses out there unemployed while they have good skills. We should not misuse these health workers. If possible, Nonm should lobby that the government should employ more and even all of the nurses out there.
We have nurses that are not employed, and recruited nurses. They've gone to college, they've finished, and they're just moving about without being employed. So we lobby for those issues so that all the nurses, if you're a nurse, if you've qualified, we are there as a mouthpiece of the nurse, provided the nurse is a member.
But how does one become a member of Nonm and who is eligible? Regina Mankamba clarifies.
If you want to be a member, if you're a nurse, obviously most of the times you would be working under a certain health facility, which is called a branch. There could be a branch there. So then you reach out to the leadership there and you ask for a form, you fill in the form, then that form is taken to the HR, human resource officer, and you're part of the system. You go into the system on check-off system. This form, when you sign that form, that means you're agreeing to be part of Nonm and the processes that are related to that being part of Nonm. For being a member, it means you have to pay for membership fees, which are paid monthly or you can choose annually. But if you're working in a government facility, you go into a system which is called check-off system. That means that's then it will be automatic deductions of your contribution from your salary. If you're working at a CHAM facility, so the process is the same. You fill in the form, and then the form is deposited at the human resource officer's desk, and they on a monthly basis they deduct and send the remittances to our account, and then you are counted as our member. Information is shared through the different levels and reaches the secretariat, and it's recognized that this person is a member. You're given a membership number to recognize that you're a member. In terms of membership fees, so if you're a diploma holder and below, you pay 1,500 per month. If you're a registered nurse, degree holder and above, you pay 2,700 per month. So this organization is open to all nurses in Malawi. Whether you're a retired nurse, you're invited to this organization. So you're most welcome. We have membership fees. Retired nurses do pay 500 kwacha per month. So yeah, you're most welcome. Join, be part, and we need your wisdom to support this organization. We also have a student chapter where we encourage students to be members because that is where we are growing from. So we are encouraging all students to be part of this, and these students also do receive the support.
Nonm is also piloting a post-TB disability project which was implemented in November 2019 and will phase out in December 2022. The project was introduced in partnership with Paradiso TB Trust, funded by NORAD through LHL International. This follows a recent survey by Paradiso TB Trust, which found out that about 52% of people recovering from TB face financial challenges due to prolonged sicknesses. Harriet Chiomba is the project coordinator and explains.
The project is focusing on reducing the burden of TB, but looking at the rights of those that have complications after TB treatment. That is among the TB Paradiso TB patient volunteers, as well as members of the union. Specifically, there are a lot of activities that are taking place, mainly among the Paradiso TB patient volunteers. We have to train the nurses as well as the volunteers on inclusive health communication, meaning we have to impart the knowledge on how to communicate to the clients that are suffering from the complications, TB complications. These trainings are national, and what we are targeting are a total of 1,620 members. So far we have trained about 599 on this activity. We also are looking at developing a lung rehabilitation program that is going to be piloted soon from January. But we intend to train again healthcare workers as well as volunteers on how to take care or to bring on board those who have lung complications due to the TB, so that their livelihoods are improved. We also have to provide some seed monies to those who have TB complications. Some of them have lost their jobs. They could not go back to doing the normal work that they do because of the lung complications, and therefore their income is a challenge. And so because of that, we also want to provide seed money for income generating activities.
Moving forward, Nonm intends to have a stronger voice and have as many members as possible move up the professional ladder from the technician level to registered nurses.
We've reached doctorate levels. We have professors in nursing. We've improved a lot, but we can also improve from where we are coming from. We can improve from the nurse midwife technician, so that we move from that cadre to only be talking about registered nurses. Maybe we can start with the diploma level, registered nurses diploma level, then moving up to degree level, so that at least everybody has got the capability of being able to freely trade their trade. They can go to any country and be recognized. At this point, the nurse midwifery technicians are only recognized in Malawi. But if everybody is a registered nurse, whether diploma or degree, they will be able to work wherever they want. So as a trade union, because this is about trade, everybody should have the right to be able to sell their trade wherever they want.
I would like to request all the nurses who are not members of this organization to become members, because we all know that we all need a mother. As nurses, Nonm is our mother.
In its quest for a self-sustaining status, Nonm has embarked on various income-generating activities that are open to the general public at very competitive rates. These include a conference hall, a boardroom, a cafeteria, office space, and sales of promotional materials like clothes and badges. For more information on Nonm membership and services, please contact Nonm Secretariat.